According to recent data from Public Health Ontario, there are a rising number of cases for walking pneumonia. Walking pneumonia is generally a mild bacterial infection that largely affects children and teens and can be commonly treated with antibiotics. Experts say that reduced exposure to common germs during the COVID-19 pandemic might have contributed to a weakened immune system in children, making them more susceptible to infections. I'm joined now by Dr. Abhishek Raut, Medical Director at Appletree Medical Group, to discuss the sudden rise in walking pneumonia. Dr. Raut, thank you for joining me today.
Great to be here.
Now, since the end of November, the province has seen the highest number of walking pneumonia cases since it began tracking the data in 2019. Why are we seeing such a rise in walking pneumonia compared to other years?
That's right. We are seeing a huge rise in cases. Public health officials in Ontario showed almost an 18% positivity rate for mycoplasma pneumonia, which is almost triple the rate seen in the previous years. Now, if we go back during COVID-19, we did certain measures like frequent hand washing, wearing masks, respiratory hygiene. And I'm not going to point any fingers, but some of us may have stopped doing that. And when we stop doing that, certainly we will start seeing these new infections come in, especially walking pneumonia, which is very critical and very sensitive to non-hand washing there. Mycoplasma pneumonia also has a very cyclical pattern. You're going to see every 3 to 7 years a huge fluctuation where you have an increased number of cases. So it does make sense that we are seeing this huge rise right now, and I do expect we'll see it in a few other respiratory ailments as well.
And what are the symptoms of walking pneumonia? And is there anything to be specifically watching out for?
Right, so walking pneumonia, or we also sometimes call it atypical pneumonia, will present symptoms which are very similar to many other respiratory illnesses. You'll see a persistent cough, sometimes lasting for several weeks, sore throat, low-grade fever, typically around 101 or 38, fatigue, headache, chest pain, mild chills as well, along with sneezing, runny nose, and ear pain. So it can be difficult to discern between them because if you look at the symptoms, this seems very much like the flu or even COVID-19. So it's very important to have that health professional assess you and look at potential treatment options.
Now, where did the name walking pneumonia come from, and how does it differ from pneumonia? You did just call it atypical pneumonia, and you said it's very similar to the flu. Does that kind of go hand in hand?
Right. So the term walking pneumonia is really to describe it being a bit milder than typical pneumonia because people are often able to walk around and do their regular activities despite having the infection because it's caused by a different type of bacterium there, the Mycoplasma pneumonia. So severity is a big part of it where it can be generally milder than typical pneumonia. The symptoms may be milder as well compared to a typical pneumonia. Causative agents, we know it's very specific compared to other pneumonia, which you could have bacteria like strep pneumoniae, viruses, or even fungi. And treatment-wise, we're very specific with our treatments for walking pneumonia, whereas typical pneumonia, we typically have to do much more investigations to see what would work best for it.
Now, I mentioned already that this tends to affect children and teens, but is there a reason that it's affecting these age groups more?
Right. So what we're seeing is children and teens still developing their immune systems. It can certainly make them more susceptible to infections like viruses and bacteria, but more specifically to this type of bacteria as well. We also know that children and teens will spend a lot of time in close contact environments like schools and playgrounds. So there's certainly behavioral factors involved there as well, including good hand hygiene. So it's not unexpected to see these types of infections flourishing more in the pediatric population.
Now, you did touch on the fact that walking pneumonia isn't always as severe as the typical pneumonia, but I'm curious, is the treatment similar to between walking pneumonia and typical pneumonia?
That's right. So I think that's a very good point. Typically, we will use something like a macrolide antibiotic, azithromycin being very common. We use that quite effectively for walking pneumonia. We'll also use doxycycline at times or levofloxacin, all of which are in the antibiotic realm. For typical pneumonias, if they're a bacterial infection, these antibiotics would actually be very helpful as well. If they're not, if they're viral or fungal, it would not make too much of a difference. So there are some overlap in treatments there.
Now, we do just have about 40 seconds. But as we head into the holiday season and there are school concerts and family get togethers, do you have any advice to help prevent this spread as people start to get out and take part in holiday activities?
Right. So I would still remember December 2021, where we had so many COVID cases that we essentially stopped counting them. And that led to a lot of hospitalizations, deaths in many cases as well. And we all think we're completely immune to all of these infections. That's a well-known fact. So instead, what I would suggest you do is think about those in your family who are vulnerable and immune compromised and look at the things that you would do that would help them, like hand washing, staying at home if you're feeling sick, or even getting your flu and COVID shots as well.
Dr. Raut, as always, thank you so much.